Welcome, guys. My name is Tonga Ichichaya. I'm a senior lecturer in occupational therapy. And today we are having another interesting session. As some of you already know, we are running a series with OT thinkers, people who are leaders in the occupational therapy profession and in occupational science. And today I'm so pleased and feel greatly honored to be joined by Dr. Nick Pollard. Dr. Nick Pollard is based at Sheffield Hallam University here in the UK, and he is currently the lead for the MSc Pre-Reg Occupational Therapy program. Nick has researched and written widely, especially in the area of social context for occupational therapy, community-based rehabilitation or community-based interventions, as well as critical explorations of occupational therapy. And the topic that we're going to be discussing today is political reasoning in occupational therapy. Apart from this, Nick has also co-edited some landmark texts in occupational therapy. Most of you might already know the books titled Occupational Therapy Without Borders. He has been part of that work. He has also co-edited the book that is called And a Seed Was Planted. There is volume 1 and volume 2, and that's a fantastic book which looks at occupation-based practices in social inclusion. And I'm so pleased and honored that I also contributed a chapter in one of the volumes. So that was great. Okay, so without wasting much time, I'm going to ask you, Nick, thank you so much for coming. I'm going to ask you to introduce yourself in your own words, and then we move on to today's discussion.
Thanks very much, Tonga, and hi everybody. I'm Nick. I've been an OT. I graduated in 1991. Sorry. I worked for about 12 years in mental health, and then since then I've been working at Sheffield Hallam University. I suppose if I'm sort of thinking about why is OT political, the key thing for me actually was that I didn't discover occupational therapy until I was about 30. And so I'd spent a fair amount of time doing a variety of odd jobs, because my first degree was a third-class degree in communication studies, and you couldn't get a job with that in 1979, the sort of beginning of Thatcher's neoliberal project, which has sort of taken us ever since into the idea that the market is absolutely the arbiter of everything. So I did a huge variety of different jobs, and that really was the kind of, an education in itself. And one of the things that I got involved in around that time was community publishing, and working class writing. So that was a major influence on me, because it really gave me the opportunity to meet a lot of people from different cultures, be told to read stuff from different cultures, and also to hear a lot of narratives, which were about different people's experiences in the UK, different working class experiences predominantly, the experiences of different minority groups, and a lot of the sort of history that you just wouldn't learn about at school, really. So that was very influential on me. It was also about organising stuff. It was about how you organise stuff in the community with no money. Which is sort of part of the sort of background to some of the writing that I've done since. And I suppose the other key thing really was actually the first job I had was working in an asylum in Middlewood in Sheffield, and being struck really as a closing asylum, and so we had the most institutionalised people who we were trying to decant into the community. And the scale of institutionalisation amongst those people, about 200 people left, was quite remarkable. So I was coming in on the bus and reading things like Alexander Solzhenitsyn's Gulag plays and novels, and recognising the same characters in the patients who I met and work with every day, and that just made me think, why am I engaged in health when actually what we're producing is this kind of incarceration? So straight away I sort of began to sort of question practice, really, and went off and did an MA in psychiatry, philosophy, psychiatry, and society, which had a very Foucauldian emphasis, and you know, learnt about anti-psychiatry and that kind of thing.
Yeah.
So I ended up with that kind of perspective really ever since. So I've always carried a fair amount of doubt about what I'm actually doing. I think that the occupational therapy role is a pretty essential one, but some of the situations in which we work are perhaps questionable. So that's a sort of broad introduction to the way that I think, really.
Yeah. Okay, thank you so much for that. Now, let me move on to my first question to you. Talking about political reasoning in occupational therapy, what exactly is political reasoning in OT, and why is it important for occupational therapists?
Well, one of the key things really for thinking about occupational therapy is that we are people. We're working with narratives. We're working with people's stories and histories. And those histories are not just the history of the individual, but actually a lot of intergenerational history that's carried with people. And if you think about what I was saying earlier on about community publishing and working class writing, and an awful lot of what actually passes as the content of that working class writing is oral content. It's things that people have told other people in conversation, and it's tacit knowledge. So it isn't written down, and because it isn't written down, it isn't valued. And that's what occupational therapy is dealing with, that kind of experiential knowledge from where people are coming at. What they're telling you about is they're telling you about their daily experiences. So if you think of, say, a program like Casualty, on a popular TV program in the UK, it was the first 5 minutes of every episode of Casualty. Not that I watched it a great deal, but the first 5 minutes was about the kind of backstory to why somebody ends up in A&E. And maybe they're stressed, they're drinking too much, they're shinning up the ladder, putting up the Christmas lights, fall off, do the back in, end up in A&E, and it's the rest of the story goes on from there. But it's actually that is the stuff that we're dealing with. We're dealing with why people ended up in A&E in the first place, or why people ended up with their particular condition in the first place, and they're going to be rehabilitated back into the community, back into those same social circumstances and social situation. But when I trained as an occupational therapist, I had a problem with this, because I've been involved in all these writers' workshops and people explaining about not just their working lives, but their domestic lives, and how they've been brought up and all that kind of thing as well. And so you sort of got a sense of how people became the people they were. But what we were interested in was the clinical information. So kind of, took an occupational history, but actually what you're really interested in is, how am I going to get this person discharged back into the community?
Yeah.
And that is very much, I think, ignoring a big chunk of stuff, which is people are very individual, very different. They come from very different communities, and you can't treat everybody the same. And we know this because we're doing bespoke treatments all the time. So that process is actually a political process. The process of developing things like writers' workshops and community publishing exercises partly was partly influenced by Paulo Freire in Brazil. So this is where you learn to read stuff, but you learn to read about how people live their lives in a critical way through the discussion, through the oral discussion, the exchange of narratives between people about, well, my life's like this, and somebody else says, well, my life's like this. And why is it different? What are the differences about? Why are people enabled to live? If you think about a map of your community, and you sort of wander around that community and look at that map in terms of house prices, for example, why is it that some people end up in a posh house and some people are ending up in, they can just about afford the rent, if that? What are those differences about? Because they're all human beings. They're all people who are entitled to the same kinds of opportunities, same kinds of chances in life, and that also that there are those differences in life expectancy. In Sheffield, there's a 15-year gap. I think you can get on a bus from the area of Sheffield by the motorway, go out to Totley, and you can improve your life expectancy by about 15 years on a £3.50 bus ride. So what is that about? That is a political issue, and we're dealing with that all the time. Everybody that comes to us has those kinds of issues, and they may not be expressed in political terms, in occupational therapy terms, because we're dealing with a clinical project. But the reality is a political reality. And if we're talking about equality of opportunity, if we're talking about equality of health chances, if we're talking about health improvements, then those things cannot be done with a walking aid. They have to be done with social transformation. And that social transformation is something that we have to build. And you can see that where occupational therapists are dealing with those kinds of issues in South America, in South Africa, and other countries where they're confronted with having to navigate systems and significant inequalities, people have recognised that those problems are there, and they've started to put, for some time, been involved in developing approaches to healthcare. Okay, so so you can see that in countries like South Africa and in continents like South America, people are or have been developing for some time social approaches to occupational therapy. Admittedly, this is a minority approach within the vastness of Brazil, but it's something which have come out of the need to work with extremes of experience, and so the outcome very much of those processes is it's often in social occupational therapy. It's based on Paulo Freire's work, very influential on that kind of approach, and Franco Basaglia's work. So we're looking at people creating things for themselves. The outcome of an occupation-based community development project in South Africa, for example, would be that people have taken on skills about community building, where they don't necessarily need to have a lot of resources, but they've learnt the process, or they've acquired a process, or they've explored, maybe contributed to that process from their own knowledge as well, towards sustaining their communities in a proactive way, which can be passed on from one person to the next. And that's just like the Writers' Workshop stuff that I was involved in. It was all very cheap because nobody had any money. And it had to be done on the basis of something that was easily translated so that other people could pick it up, because it was a campaigning thing. The idea was people would learn to do this stuff and do it for themselves. So if you can, as an occupational therapist, be involved in kind of injecting that kind of intervention into the community, or helping it along, or linking those community objectives to health, then that is a way of participating without necessarily having a party political affiliation. But it's just about getting people to or encouraging people to take steps to recognise and manage their own problems.
I mean, I like it when you said we're not necessarily having sort of like a political party, and that brings me to my other question, because for some OTs, the moment you start saying this discussion is about political reasoning, they might immediately think of the politics, the bigger politics in terms of governing governments and things like that. I'd like to hear from you. Is it, number one, is it possible for occupational therapists to say they are apolitical, or they are not getting involved in politics as part of their practice? I know there have been discussions about the big P, the small p. What's your take on that?
Well, I think if you were going to be involved in initiating some changes in the community service, you have to work with everybody, and you can't afford to parade a political perspective of one colour or another if you're going to actually bring people on side, because those people that you might be depending on might be business leaders, they might be conservatives as well as Labour politicians. They may be people who have just got the reins of power, and they're going to give you a foot in the door to make some improvements which they may need, and your situation is that you need to work with anybody who is going to be, on the side of positive change. It may suit them to work with you at that particular time, but you can't afford to make an alliance with one group and then compromise the work that you're doing when those things change, because administrations change. So I think that's one difficult thing to sort of bear in mind. It's very difficult for me because, as people will know from reading my stuff, I probably have a fairly left-wing persuasion, but it is a situation that you have to bear in mind that practically that's how you've got to work. But health is political. The first duty of every government is to look after its people.
Yeah.
So therefore, it should provide welfare schemes. It should provide support. It should recognise that some people do not have all the opportunities that they should have, and that everybody that it's looking after is a human being, and so it has to actually be given some basic things. And if we look at things like, he's not an occupational therapist; he's an economist. So one of the people that many occupational therapists have quoted is Max Neef, who wrote about human scale development values. And one of those values is a place in which to be. So if you think about doing, being, becoming, and belonging, then the first thing is having somewhere from which to be in the first place. And that is a very fundamental issue. It's about land rights, actually, which is very political.
Yes.
And it's very political here in the UK. People don't understand, or people don't understand. It's not fair. People don't recognise necessarily that the fundamental issues in building democracy in England is related to historic struggle for land rights going back to almost pre-Roman times. I mean, it goes all the way back, but certainly what the issues between the Saxons and the Normans, or between the peasants and the nobility were in the Peasants' Revolt, about land rights. William Morris, who was an architect of the arts and crafts movement, and so very influential in occupational therapy, was very interested in that particular relationship, and that is something which is sort of carried through. So actually, it does go all the way through to occupational therapy as well.
Nick, it's very interesting for me when you talk about land rights. Me being somebody who comes from Zimbabwe, I sort of really understand the fundamental issues when it comes to the land rights and the rights for people to engage in occupations that are meaningful to them, that are valuable to them. So but let's not go down that rabbit hole of discussing the land rights now, because it will need a whole session on its own. Let me just move on to my next question. So we have been looking at political reasoning in occupational therapy. How can occupational therapists use political reasoning in their daily work? And if you have any examples, please do share.
I think the fundamental thing is in relation to recognising what opportunities are available to the people that you're working with, and talking about how they might be seized upon and changed. And in a way, we're doing it's very, very basic. It's so basic that you might almost not recognise it as political. But for example, a group that I was involved in did some work about writing with people with learning difficulties, and writing that was going to be published. Now, the idea that somebody with learning difficulties is going to publish something in black and white that's going to be read by other members of the community, and it's about stuff that people with learning disabilities want to do and are maybe not enabled to, is itself quite controversial. But then it came down to other stuff like what would they want to do? Because what opportunities are actually available to this group. So we asked them if they could do anything, what would they actually like to do in terms of a job role? And there were things like, I'd like to work with horses. I'd like to be involved in I'd like to teach.
Yeah.
Why can't a person with learning disabilities teach other people? Why can't a person with learning disabilities work with horses? Well, actually, one of the fundamental reasons is because they're incarcerated in a care home, and nobody's got the time to take them down to the local stable so they can actually do some volunteering work. What does it take? 3 hours a week, maybe. And that would give that person that sense of belonging to an environment where they can work with horses for 3 hours a week, and that's what that's part of their relating to the community. So everybody has to have that access to citizenship. So there's if you look at my stuff, there's a free book about citizenship you can download, which has a load of resources connected to it, which are about how those ideas can be taught.
Oh, that's great. I'll put that the link to that resource in the comment section. That's fine. Thanks for that.
Yeah, so it's as simple as that. The people that I was working with who had mental health issues were severely disenfranchised.
Mm-hmm.
And they were disenfranchised in lots of simple ways, but those ways fundamentally undermine their dignity, their right to present themselves as reasonable human beings capable of doing all the kinds of things that we might like to do. And some of the stuff would be that as soon as we drove the minibus outside the hospital gates, a lot of the sort of bizarre behaviours would start to drop. And by the time we got ourselves out into the community, we used to take people out to Derbyshire from Sheffield a lot of the time. Then, we'd unleash a minibus full of people on some quiet Derbyshire village where they sort of go off and get a cup of tea and sort of thing, and maybe engage local people in conversation. Quite often happened because they were quite garrulous. And they can have a normal conversation with people. They can be part of that community. They just have to be tolerated.
Yeah.
It doesn't take much. I mean, it does take a lot if you've got people living next door who are doing strange things and maybe, you worry about your kids and that kind of stuff. But on a day-to-day basis, why can't people do that? There's one guy who actually walked across town and got himself a job in the lumber yard. And, he went back to the asylum at night. Nobody knew this was happening for several weeks.
Wow.
So, people are quite capable if they're given the opportunity.
Exactly. Now, I want to ask this in relation to thank you so much for the insights that you've shared. What if somebody says, okay, I'm an occupational therapist, I'm working in a very acute setting, for example. Is it possible for me to be applying political reasoning? What would you say?
I think it is, but I think it's about it's where you work. The access to those kinds of opportunities may vary a great deal, and I suppose it's more about how you apply that political reasoning to your thinking about what is possible for that person further down the line. So it's looking in terms of their future opportunities, in terms of maybe the connections you make with the people that you're referring on to, and the kind of direction that you're building a care pathway towards that perhaps has that. And one of the things that you can think about, I suppose, might be there are lots of ways in which you can insert public health messages into those brief encounters with people. And the same kind of thing can be done with kind of nudging people into occupational opportunities. People tell you stuff, and ever thought about, maybe if you have difficulty reading, that maybe you should find you could find out that it's possible for adults to go back to college and pick up literacy, and that would open up a whole avenue of occupational opportunities, for example. So, there are lots of things like that we have because we have a particular relationship with people where we're just talking about them.
Yeah. Wow. Thank you so much for that. Now, I know my time is running, but my last question to you, Nick, is the future of the occupational therapy profession. How do you see the future of OT? Is it the future that you would want? If not, what sort of future would you want to see occupational therapy?
Well, I think for the future of occupational therapy, I think there are some sort of key questions to think about. One is, how do we insert ourselves into the kind of changes that are happening in the health system? So we've got an opportunity in the UK where we have moved towards sort of more community-based approaches through the NHS plan, an interest in social prescribing. But we've got to be able turn that around a bit from it being a kind of medicalised social prescribing into something which we work with the community and which doesn't actually undermine community resources. And so that means that we have to be very much more aware of the range of communities. If you think about Sheffield, for example, there are something like 200 different first languages in Sheffield, a lot of significant communities from Somalia, the Yemen, there's a large Pakistani community. There's a lot of different groups who you need to actually kind of work out with a big Roma community as well. Actually, you have to think about how are we going to make connections with these people so that what we put people on, so we can bring people in, but also that we can actually work things with those communities so that people actually get what they want. So that requires some rethinking about the profession. We have to really sort of take that, I mean, we're talking about land rights, and actually, it's not that. One of the key things is talking about the colonial process, because we've actually now got 14% of the population from outside the UK.
Yeah.
We have to really address that basis. We have to address the way that we do, that we are a diverse profession. If we're talking about people doing stuff and becoming and belonging, then we have to actually take on that whole. We don't have to know everything about everybody else's culture. We just have to be interested in it, for one thing, and actually sort of, wow, that's amazing, because we can use those connections. A lot of the stuff that you can do, you can use those differences and connections to get people to say, well, my life's like this, my life's like this. We do this. You can learn stuff, and that is something that occupational therapy maybe has to do. I think that that's one of the things. One of the other things is maybe to beef up its approach to research and making that connection between these sort of social issues, the social and political issues, and their significance in terms of health.
Yeah.
Because I think that is something that is quite difficult, because we tend to work with very small numbers to actually make effective. But we've got to get that across and insert that into the broader health message. That's the way that we can then illustrate to the GPs, who are then going to be operating the social prescription services, that actually we're really useful. And we've got a way of connecting with the community so that actually we probably end up reducing the demand on GP services because people are doing stuff they want to do or changing the things, feeling active in their lives.
Hey, great. Thank you so much, Nick, for those insights. And I do hope that our audience will also find this helpful. I think each and every one of us, if we take a few steps in the right direction, I mean, collectively, we can actually make a difference.
Thank you very much, Songai.
Okay, there we are, guys. We have come to the end of this discussion. We have been discussing political reasoning in occupational therapy with Nick Pollard. Very insightful. And you guys, if you manage to have access to this video, feel free to share it with other colleagues who might be interested in it, because this is Motivate OTs, all about inspiring occupational therapy students, inspiring other occupational therapists, and also inspiring anybody else who is interested in our discussions around occupational engagement, as human beings are occupational beings. Okay, so thank you so much, Nick.
Thank you very much.
Okay, bye-bye, guys.
Bye, everybody.